Hey everyone, Dr. Eric here from MedBetterHealth. Let me ask you a question. Were you ever wondering, are there any blood tests when it comes to dementia? Well, if you're wondering that, you're not just going to hear from Dr. Eric, but you're going to hear from the GOAT, the greatest of all time, Dr. James Galvin. He is known as the GOAT when it comes to memory care and neurology. And if you're interested in knowing about those blood tests, this show is for you. So, Dr. Galvin, one really important question that the audience wants to know is, we went to Washington and we were advocating in front of senators and congressmen about something called ASAP, the Alzheimer's Screening and Prevention Act. And in essence, what we were saying is, hey, there's these new blood tests out there. They're somehow connected with Alzheimer's, let's say, right, for the layman, and we want Medicare to pay for it. The question is why? Why is it significant? What are these blood tests? Do they tell me that I have dementia? Do they tell me I'm at a risk of dementia? If someone's going to their doctor, can they order that blood test right now? I'm sure people watching, that's the questions they want to know.
Right. That's a great question. So there are a number of blood tests that were developed. So back in the old days, right? So when I started practicing, Alzheimer's disease was a clinical diagnosis. So I would use published criteria and say, did that person look like they fit that criteria? And then here's your diagnosis. But I would never know if I was right. The only way to find out was after a person died, if they had an autopsy, we could study the brain. But otherwise, I was guessing, right? Now, I think I made good guesses, but I was guessing. What's really changed is the development of these laboratory tests. So now we can actually demonstrate Alzheimer changes in the brain of a living person. We can do that through some specialized imaging studies called PET scans. These are nuclear medicine scans. We can do it through spinal taps.
Mm-hmm.
But people don't like spinal taps, and PET scans, one, are expensive and are not available everywhere, right? So in South Florida, there's a lot of PET scanners. In Boston, there's a lot of PET scanners. In Montana, not so much, right? So it wasn't readily available to everybody.
And maybe also a little bit on the pricey side.
Very pricey, right. But blood tests really have changed the game. They're changing the way we're practicing. So there are blood tests that have been clinically established, and now 2 of them so far have been FDA cleared, which means they're eligible potentially be covered by Medicare. And so what those blood tests tell us is how likely the person who has symptoms, are those symptoms due to Alzheimer's disease?
That's interesting. So you said how likely the person who has symptoms may have, am I saying it correctly, Alzheimer's disease?
So if you have symptoms.
So, okay, hey, Dr. Galvin, I don't know why, but I'm forgetting stuff. All right, here, let's do a mini cog, let's do a mocha. I do it, something's off. Then you say, okay, let's do a blood test.
Correct.
And then what happens?
So there are a couple of different types of blood tests that measure different things, but essentially there's a test that was approved for primary care, right? It looks at a protein called phospho-tau 181 or p-tau 181. And if that level is low, that essentially rules out Alzheimer's disease.
If that level is low, and I have, for example, memory or cognitive symptoms, but that level is low, it rules out Alzheimer's
disease, which means
nothing else but Alzheimer's.
So that means then the clinician could then say, okay, now we have to do this, and this
to see what's causing that
it.
memory.
Correct. Right. There's another test approved for specialty care, so like neurologist, right? It's a different protein. It's looking at this phosphorylated tau 217 or p-tau 217 over the amyloid protein. So it's a ratio, and if that is elevated, that rules in Alzheimer's. So a person who has symptoms, who has an abnormally high level, that means that Alzheimer's is the cause of their memory symptoms. So we have a test that we can use to rule out disease, and we have a test that we could use to rule in disease. But the key thing is these are for people who have symptoms. That's the reason. That's the way the blood tests are currently being used correctly in clinic, is only if you have symptoms. These tests are not designed in the clinical setting.
As just a general screening for everybody.
Screening for everybody.
That's an important differentiator. So if you have symptoms, that's very important. There's a lot of because this is all new. People don't really understand, when do I get it? How do I get it? Who gets it? Who pays for it? And we're trying to get Medicare to pay for it. And we're actually calling it in the Alzheimer's Association our mammogram moment.
Yeah.
It's our mammogram moment. So,
but it's not. So it's not quite a mammogram moment though, because you don't have symptoms to go get a mammogram, right? You're a woman. You're a certain age. You go get your mammogram because you're looking for something. These tests currently are for people who have symptoms. People who do not have symptoms should not be getting these blood tests.
That's an important differentiator.
Not in a clinical setting. In a research setting, that's different. But in a clinical setting, these tests are not designed for people who do not have symptoms. There's a couple of reasons of that. One is that you can have the changes in your brain and not have any symptoms and may never develop symptoms, right?
So now instead, if you just got generally screened, you're walking around your whole life, you may not get it, the disease, but you're always scared or nervous.
That
and
you might. And
that
then
you might.
Every time you make a mistake, it's like, no,
is
it's
it
this,
that?
The other thing is that unlike genetic tests, there's no law protecting discrimination against a blood-based biomarker.
Wow.
So if you're asymptomatic and you go get a blood-based biomarker from your doctor and it's positive, it's in your medical record, you are now uninsurable, right?
Wow.
So no disability insurance, no long-term care insurance, potentially affecting life insurance policies, potentially affecting medical insurance policies, right? Because it's now a pre-existing condition, right?
Wow.
These are tests that are not designed for people without symptoms. They're only for symptomatic people. That may change in the future as we develop new medicines. But right now, if you don't have symptoms, you shouldn't be doing these tests.
Incredible. See, that's why we have folks like Dr. Galvin, who's an expert on the show, because
I'm the GOAT.
You're the GOAT.
I'm the
You're
GOAT.
The greatest of all time. That's a fact. And listening to you today, that actually proves to me why I felt that, why many people say that. That's an important differentiator. Imagine a world where health information and exchange, your information is out there, insurance information can get that, because now we're going towards that, where I can put in your name and see exactly where you went and what happened, and then say, sorry, you have that, you're not insurable. But I don't have symptoms, but I don't have it, no, it's in your blood, I'm sorry, we can't insure you. That is huge. I want to jump to something else that's super important. So now, if you got value from this video, I want you to imagine a world where caring for your loved one with dementia doesn't mean doing it alone. Imagine a world where you can have someone to help you at home taking care of your loved one. And imagine a world where you have 24/7 access to support when you need it. Well, I got good news for you. You don't have to imagine it anymore. This is now a reality, and it is now covered by Medicare. If you're interested in learning more, very, very simple. I want you to look up over here. We have our link to our website. Visit our website, scan our QR code, look in the description for the link as well, and don't imagine anymore. This is now a reality.